Thank you. Good afternoon. I just came from the airport from St. Petersburg. Let me share with everybody where I was born, where I was from, why am I spending so much time in Europe, in Israel, in China, etc. First of all, I know you're all getting quite, restless, and this is the last talk. So I try to make it very interactive and also very easy to digest. I know everybody is from the healthcare industry. I'm a medical doctor by profession, born in Singapore, studied in Australia, and then became a medical doctor and also a medical inventor, trying to put technology and healthcare together over the last 20 years. So I was also the world's first medical inventor to put digital hormonal mapping together in Japan, trying to create a wireless contraception in Japan in 1999, where the smartphone is able to understand the physiological cycle, the skin pulse behavioral pattern, the physiological food cravings, so on and so forth, in addition to just being a phone for social communication, but it talks to your body. So over the last 20 years, I have quite a colorful career. I have my own TV show in Singapore, and they call me Dr. Love, because in Singapore, it's very hard to make baby. Everything becomes more and more expensive, and it can be quite monotonous, so people are not making baby. So when I actually pioneered a wireless sex education program for the Dutch government in 2000, that was the first sex education program on mobile. Now, why at that time, an Asian guy, but having a pretty open-minded view about biology, was asked to assist with the Dutch Health Promotion Board when they introduced a school-based sex education. They saw a spike in the teenage abortion. So it was very, very difficult. That is in 1999. Everybody was thinking, how do we solve this? At that time in Holland, there was no big data. A mobile phone, everybody was just SMSing. And at that time in Japan, NTT Docomo was introducing an iMode platform, which is almost like the iPhone platform onto a normal phone in Holland. So that was at 2.8G's phone for the first time in Europe. Now, the kids, after having the right knowledge, so on and so forth, are having a lot of problems, and the government actually doesn't know what to do because they do not visit the clinic, they don't read the newspaper, and so on and so forth. At that time, the only way to harvest big data from all the kids that are, a lot of them are going through teenage abortion, was via the mobile phone and on SMS. So I was, at that time, happened to be in Holland with our Japanese consortium, and that was a problem. So we created a lot of server platforms in Holland and trying to create this 6,000 doctors in Europe. The program is called Sex in the Air. Maybe some of you might have heard it, right? In year 2002. So we collected over many days of campaign. All the kids were really coming together asking questions. Now we collected all this data to allow the Dutch government to think about what next. Were they looking to promote the awareness of sexually transmitted disease? Or were they looking to promote the notion of contraception or other things? With that program, which later on became a global showcase for WHO at a very early stage on big data at grassroots level, redesigning public health education by listening to what is happening on the ground, became one of the first kind of case study where public programs are redesigned again. So today, we are doing more. Today, we have even launched reality TV program in health edutainment. So last week, when I was in Shanghai, we actually launched the world's first fertility reality TV show. Now, why? Because there are 90 million couples in China looking to make the second baby after the policy came out. But in China, there are only 40 functional IVF clinics to do test tube baby. So over the last 2 years, the cost of IVF has become the highest in the world, or one of the highest in the world, with very low success rate. So, and the government with that policy, they haven't got the grassroots feedback. It takes about 1-2 years for a big country like China for this policy to get socialized into the grassroots. But the government doesn't know whether the couples at home, what are they eating? Are they reducing their alcohol consumption? Do they know that the sperm and egg quality are not improved by test tube baby IVF, which is basically putting the egg and sperm together, but it doesn't really improve the quality of egg and sperm. And that is a big problem. China's success will be very dependent on the ability of China going forward in terms of population rejuvenation, in terms of the quality of the sperm and egg. And for a country like China, with now 90 million couples looking to make a second baby, it will take more than 10 years for them to actually get a fresh egg. So imagine more than 50 million couples in China are actually above 40 years old, right, and want to have a second baby. So by the time they wait for the fresh egg, because after 40 years old, the quality of the egg are compromised, she will be 52 years old. So now that is a very, very difficult program. So we are talking about now, it is not just about a wearable on the wrist, thinking where I'm providing the data to the consumers and the consumers will wear it forever. Many wearable companies fail because they didn't understand. They think healthcare is connective. They think healthcare is just about the data presented to the human being. But that human being is not a patient. He maybe doesn't really understand data. Might like it for 6 months, but then he's going to take it off. Most wearables are not able to evolve into wearable 3.0 because the engineers that are designing it only stop there with the data. But what can the data bring to the consumer? Not the patient, but the consumer. The consumers really want personalization of content. The consumers really want personalization of services and products. So if you look at it, even a very dinosaur industry like insurance company, they are really living in this 15, 20 years old school era of distant epidemiology, where static data and piecemeal data are actually harvested from the hospital without a lot of data live, harvested from home, harvested via the sensors at home, via the wearable, so on and so forth. So today, even a lot of experts talking about big data, they have focused too much in the hospital-centric data, which is the y-axis, which is something that is episodic. The whole data foundation requires not only the hospital data, but the data from home. The data that is live, that is always on data. And of course, the data from the genomic map, the genetic data. Now, with all this Y-axis data from the hospital, X-axis data from the home, and the Z-axis data from the genetic diagnostic and genomic map, etc. This is the real data foundation for predictive healthcare. So I will be speaking on this perspective. I'll just go through the slide very, very quickly to talk about the new medical civilization. For the first 5,000 years, as medical doctors are looking at the model of if you are sick, you come to me, I will look at your symptoms and give you a differential diagnosis, and I try to put something onto you. But the next 5,000 years, I think we are talking about when you're not sick, how can I understand you more? And looking at the human being in front of us, not as a patient, but as a consumer. And that is really, really very important. Because without thinking about the human being in front of you as a consumer, we will never understand how to harvest data in a sustainable way, which is very important. Because a human being, the moment they depart from the clinic or the hospital and get back home, they are really about the hindbrain. They have the dreams, they have the aspiration. It's not about their disease. A lot of this problem will end up with non-compliance. So it's about the aspiration. What is consumer-centric healthcare? What is aspirational healthcare? To get them to really love doing something, not just putting here to monitor it. It's something more psychological and even something more primal and something more hypothalamic. So that is a new medical civilization. Now, about 10 years ago, I decided to create a group called Borderless Healthcare Group. And over the last 10 years, we've invested over 20 plus companies from smart health, smart education, smart aging, smart care, right down to smart farm. Now, this is very, very important because we think we are dealing with a consumer right in front of us. We think that he or she wants to eat the right food, but the recipe that comes to the smart kitchen needs to be designed by the biodata that is harvested from their body. So all this becomes sort of a new convergence of data, resources, and space, and looking at this new order of data where hospital, genomic data, and home harvested life stage data are converging. The death of the traditional healthcare insurance. Today we got almost all the major healthcare insurance coming to us. Why? Because we have created a model that are harvesting data from the home. It's not only on small screen, but we are saying the home is becoming an omnimedia. It is about small screen, medium screen, the computer screen, big screen, the TV screen. How can we harvest data from all media and how all this media will be able to deliver personalized content to you. So that's why a lot of reinsurance group, a lot of insurance company are very excited about this because we are getting the data earlier than them. For example, most of them would have the data maybe about 30 years old when they get married and have a health insurance or house insurance, whatever. But today, we are creating new fertility data. We are seeing the trend of social egg freezing. We are seeing the trend that women want to not only look at how to have the right pregnancy, but they want to look at the notion of reproductive asset management. The eggs is a fixed asset. So they want to know how, if I'm going to prolong my career or I haven't found the right guy, they want to be able to freeze the egg. So when you have a trend like that, insurance companies love it because we are looking at the data in the early 20 years old where, especially in Asia, people want to do the PhD, they want to do 2 masters and all that, they delay the marriages. So they want to freeze the egg. So a lot of them freeze the egg. And this is almost becoming a fertility insurance on the left shift because the data comes from somebody when they're single. So this the change of this insurance trend. And of course, now if you look at the aging trend, is after 60 years old, no insurance company will want to insure you. But today we are saying that if the over 60 years old are continuously doing the exercises over the sensor where they can follow different kind of exercise regime and all that, we know they are well. So continue to actually insure them and don't increase the premium. So insurance industry are actually responding to this. And this will give rise to proximal actuarial study and a new kind of insurance products. The era of predictive healthcare from those data. So we are saying that it is not about the internet clickable economy. Today, you can see a lot of media having a platform A, platform B, and is clickable, and even the valuation of internet companies are about the click rate, the number of database, so on and so forth. But you know, for healthcare, especially for big health, it is not about whether you click A or you click B. It's about the habitat economy. It's about where you stay and how the data are harvested, what sort of personalization of services and products and content that comes to you. So it's about your home becoming the omni-media, home becoming the data hub, home becoming the content hub. So harvesting of data, food chain management, you know, so on and so forth, are all part of big health. And we even have a project where in Australia, the cows are wearing our wearable, and the Chinese consumers can own the cow borderlessly. And the moment they join as a member, they actually have 300 boxes of virtual steak, so that the housewife can stay at home using the smart TV to usher all the top chefs in the world and nutritionists in the world and do an interactive cooking workshop with her friends at home and sell those 300 boxes of virtual beef. All right, so this will be announced in March in one of the biggest agricultural conferences in New Zealand and Australia. So these are the things that home becomes the new commerce platform, becomes a new personalization hub. And yeah, that's a zombie. And so we are talking about not about just advertising revenue on a media platform that is not sustainable. We are talking about a new kind of media where your body becomes a media, and the whole biology of things, your biodata can determine how health and care and the kind of food that comes to you. And that can solve everything from non-compliance problem to food safety problem for the government to many other issues, excess of healthcare expenditure, so on and so forth. So everything is customized. So I'm just ending my talk with this little slide on the emergence of not just artificial intelligence. This is all about the new era of biointelligence and having it applied over food chain management, having it applied over, product personalization and service personalization. Thank you.